What's up, everybody? Welcome back to the Move Better channel. I am Dr. Joe, and this is John Penisarada. Today, we're going to be talking about grip strength and what's causing that weakness that you might be dealing with, and maybe some tingling and numbness in those fingertips. How are we going to fix it? We're going to show you guys today. The first thing that I check out as a practitioner is where this grip strength weakness is coming from. And it could very much so be coming from the neck, the shoulder, and the dysfunctions that come along with it. Now, if it's coming from the neck, we do a variety of different tests for that, right? And some of the things that you guys can do at home, all the stuff that we're trying to teach you guys here on the Move Better channel are some exams that you guys may be able to do at home to just maybe rule in or rule out some of the deficiencies that may be causing the grip or fingertip strength. One of the things that I have my patients do is, can they laterally flex their head? And if they laterally flex their head, are you having some tingling and numbness going down your fingers just by this? Are we trying to rule out where it's coming from? And we're trying to rule it out from the neck, right? Because the nerves come from the neck into the front area, into the back of the arm, and it wraps and it twists around, and then it reaches down towards your fingertips. So if you're having some fingertip numbness or tingling, normally tingling pain will be a nerve, maybe a nerve entrapment or a nerve impingement. When we say an entrapment, we're thinking an entrapment from maybe a tight muscle or an imbalanced muscle that's causing a radiation of symptoms down towards your fingers. Sometimes everybody presents completely different. Sometimes they may feel it through the shoulders. Sometimes they may feel it all the way down the arm. Sometimes they may feel it in one place or two places. Sometimes they'll feel it in their elbow, and sometimes they just feel it in their fingertips. We want to rule out anything that's possible, especially when it comes out from the neck area, okay? So we want to rule out a couple things. Leaning your neck laterally from side to side. We're going to try to look up and see if it hurts when you look up. And you got to hold that position for for about a minute or so to see if that radiation of symptoms goes down your arms. And if it does, it may come from your neck. And if it does come from your neck, I want to recommend that you guys go and see a doctor right away. Check your primary, check a physical therapist, check a chiropractor, see how we can rule out anything more pathological that might be more serious, okay? So those are the things that I want to say. Those are red flags for you guys to go ahead and get checked out right away. Looking up, looking down, rotating your head in any direction might cause that tingling, numbness, that pain, or even weakening your grip strength right away. So we want to make sure that that's taken care of, okay? The next one that we want to check is we want to go a little bit lower. And we've done an old video on this before on how you guys can fix it. It's called TOS. Ding! Ding! Right here. So on the TOS side of things, we want to check, can we bring their arm back? And right now, as you can see where I'm checking, I'm moving his hand back, I'm checking his pulse. I'm trying to see if the strength of his pulse is getting stronger or is it getting weaker. Now, the strength of this test is not very strong. I mean, I can't necessarily say for every single person we're going to have a tingling or numbness or a pulse discrepancy or a weakening pulse and say that that person has TOS or has not. So it varies from person to person, but make sure that you do get checked if you're finding these signs. So I'm going to bring his arm back. I'm going to go ahead and check, and I'm going to see if the pulse weakens a little bit or if he has any type of tingling and numbness, and if it recreates that grip strength weakness, okay? And you'll know if you have grip strength weakness just because you'll feel your hand is like loosening up, and it's like, oh my God, I feel it getting worse. So I check this way, I pull his arm back, I check the pulse, and I have him look and laterally flex over towards that right hand side. I'm tensioning the muscles, and I'm trying to see if there's a pathway that this nerve is being impinged and causing some tingling, numbness, or even some weakness within his hand over here. The next one, I'm going to have him look away or have him look back at his hand while tensioning this. Now, the things that you guys can simply do at home is you could put your hand along the doorway. Imagine my arm is a doorway, and he's just kind of stretching out his chest, and he's looking back at his hand. And if you guys can find that there's a tingling or numbness or a discrepancy or a weakness in this pattern right here, we are looking at what we call a TOS problem, okay? Now, again, check to see if you can do those on your own. If there's a problem there, you might want to go and seek a professional to go ahead and get that checked out, fix it, and find a way and make sure that there's nothing more serious that is causing it. So how do we fix some of this grip strength problems, okay? If the problem is coming from his neck and his shoulders, first get checked. Second, there's a few things that you want to do in order to help it out. One, we check to see what kind of patterns help to relieve it. One of the things that he could do is he can give himself a big hug. And if once he gives himself a big hug, does he feel pretty tight in his chest? Do you feel tight in your chest? And if he does, and all of a sudden it's actually making the pattern worse, one of the things that we could do is we could start stretching the chest out. We could start rolling out that, using a foam roller to release tension off of the things that are overly active or overly tight, which is his chest muscle, his lat, and everything that's causing that internal rotation of the shoulders. Now, if it doesn't feel tight, and then all of a sudden his grip strength starts to feel a little better, we need to add into that strength pattern, and we need to do these movements a little bit more, right? And because what would happen if he does this pattern more, it changes the way the positioning of the neck interacts with the rest of the body, okay? Lastly, grip strength could be coming anywhere down from this whole pattern right over here. What we could do is I could literally just grip his forearm right here. And if that changes his grip strength, go ahead and grip, squeeze. If that changes his grip strength, we might need a brace that helps brace this until he can gain proper function of his grip strength. One of the things that we could do is we could get a lacrosse ball, or in our case, we have a softball here. You're gonna grab that and you're just gonna push down on that. If the brace works, we're gonna try to allow movement of these tissues. We're gonna try to get a better glide, trying to get the fascial restrictions to loosen up a little bit. And as he's pushing, that feels pretty good, right? Notice what he's gonna try to do here. Right now, he's pretty relaxed. He's pressing down, but we wanna get in and communicate with all the tissues in that area. So he's gonna do some grip strength. And then he's gonna try to open up his hand while he's pinching down, because the muscles that control the hand are all in the forearm. So we wanna release tension off of those forearms, off of the muscles of the forearms. And most of the time when we're sitting at a desk or we are weightlifting or doing anything, we're always focused on our wrist flexors. So we wanna try to release as much as we can along those wrist flexors, and then let's flip this around, we can work on grip and working on these extensor patterns, right? Now, these exercises, we could use a ball to just work on these, right? And so we're just simply, and this is a pretty light exercise that you guys can do at home. You can simply just go up and down to try to get those muscles to activate. Now, because it's light, and these are endurance muscles in this case, we want to try to work for endurance, meaning we want to do high repetitions and higher speed, right? So we want to go up and down, up and down. We want to just go up and down here, okay? So we're working those extensor patterns. Now, the things that I like to teach my patients, go ahead and stand on up, John. You're going to grab that ball, and you're just going to play catch with it. And you're gonna be working the pattern all the way up to the shoulder. This is kind of like a plyometric exercise. Try to let it drop a little bit more. Try to create some space within your fingers, and that will allow for better strength off of the whole extensor pattern. Even though he's gonna feel a little bit on that forearm, again, these muscles up at the top here, those extensors, are trying to grip to make sure that the ball doesn't fall. Try it, and this is a little bit more of an aggressive exercise, an aggressive move to try to play catch with it. You know, we're playing with the nervous system, we're playing with reflex reaction. This is a great exercise for the shoulder, and this is a great exercise for the wrist and reaction drills for your whole body. So if you guys like what we did here, like, subscribe, comment, let us know below on how this helps. If you guys know somebody with some grip problems, some tingling and numbness going down their fingers, make sure that they do not wait it out or push through any of that type of pain. We want to make sure that we get that fixed. Check the primary, check with a chiropractor, check with a physical therapist on how we could possibly be able to help you guys move better and feel better. Thanks, you guys. Until next time.